Clasp adjustment, starting with Adams clasp. Many times when a patient has an appliance, they use the Adams clasp to take the appliance off, and they'll take and spring the clasp, such as I just did, and the clasp will sit high in the occlusion. Now, to adjust this problem, with all clasp adjustments, you start at the acrylic. You'll go right next to the acrylic, twist downward or occlusally. Now, many times you may get a little piece of acrylic that breaks off. That's no problem. Just take a little soft burr and finish the acrylic down so there's no tongue irritation. So basically, you'll turn down right next to the acrylic, turn down right next to the acrylic, and what happens is the Adams clasp will be slightly over adjusted, but it is down in the contact where you've activated. Then you'll come back to adjust the appliance and put a step down bend, move about 2 millimeters over, twist back up, and that will put a dip bend in the occlusion, which will allow the patient not to bite onto the clasp. Such as this. Now the appliance is down in the occlusion with a slight dip bend. After you've achieved the dip bend and the wires fitting closely to the tooth next to the acrylic, many times what happens, the clasp is not engaged buccally on the ears, so you have to get the clasp into the undercuts and touching the teeth. The best way to do this is grab the ear of the appliance with the flat on flat, turn toward the tooth, and you do this one at a time to gain retention. And this will take the Adams clasp back into next to the tooth, giving you maximum retention. Many times doctors will take a 3-jaw to the bar on the buccal and squeeze, which bilaterally brings the ears in, and this weakens the buccal clasp, and actually many times you will overactivate it this way, so that is an improper activation. Ideal is to grab the ear on one side, turn it in, ear on the other side, turn it in, and you'll get maximum retention, such as you have on this Adams clasp. After clasp has been adjusted at the acrylic, dip bend, and converting the ears buccally in contact with the tooth, this is a properly activated clasp. All ears are in contact, wires out of occlusion. So anytime you're looking at the appliance in the mouth, make sure the Adams clasp is engaged and tight to the molar or bicuspid, wherever the Adams clasp is positioned on the appliance. Additional retention needed for Adams clasp, you can place a spot of composite just below the ear. So when you place the Adams clasp on, the Adams ears will snap over the composite to give you maximum retention. Many times you can just place it on the mesial, but if you want maximum retention, you can place it mesial and distal for maximum retention.